Hello everyone, welcome. So, next topic we go ahead is reproductive health. When we talk about reproductive health, we have already talked about the reproductive system, and to keep it healthy is belonging to the reproductive health. So, according to WHO, reproductive health means total well being in all aspects of reproduction, that is, physical, emotional, behavioral, and social. So we need to keep the physical parts of the body very good, very healthy. And once we are physically all right, then it is basically hormonal changes that takes place in the reproductive health, which affects the emotional part. So emotionally also one needs to be good when a sound whenever there is any kind of issues with the reproductive health, then what happens is we are unable to speak it out, and we are unable to describe what is happening that affects us emotionally as well. And there are various behavioral changes that takes place. We feel irritated, we feel not good. So all these things, and once all these changes takes place, what happens is the social the social responsibility of us, the socially how we interact with people, the socio-cultural life also gets hampered. So we need to take care of both physical, emotional, behavioral, and social well-being. So reproductive health, what are the problems and strategies? First and foremost, India was amongst the first countries in the world to initiate the program family planning, which was initiated in 1951. They already had stated hum do hamare do, and now it's hum do hamare ek. So there are family plannings which always states what is a gap between two babies, if at all we need to keep, and all those. There are various scholarships and all which is given to single child or single girl child, all those. Reproductive health in a society forms a crucial part of general health. Improved programs covering wider reproduction related areas are currently in operation under the name of reproductive and child health care. So this program, RCH, which is reproductive and child health care, is very much concerned with the programs which is put up against the reproductive health. Health and education of young people and marriage and childbearing during more mature stages of life are very important attributes to the reproductive health of a society. Government, as I was telling you, that they have taken various measures, like through the help of audiovisuals and print media, they keep on making us aware. Even family members, close relations are involved in the awareness. Sex education are introduced in the schools to provide awareness. So you kind of had chapters on sex education. Proper information about reproductive organs, adolescence, and related changes, safe and hygienic sexual practices, sexually transmitted disease, AIDS, all these things are indescriptive being taught in the schools and are always being shared. So we have this as the steps taken by the government against reproductive. Now, aminosynthesis, what is aminosynthesis? Aminosynthesis is a prenatal diagnostic test in which small amount of amniotic fluid is removed to determine any genetic abnormality. Now, where is this amniotic fluid? Amniotic fluid is the fluid inside which the baby is kept. So it's the womb, the covering of the baby. So amount of amniotic fluid is being collected, and it's a technique used to find out the chromosomal abnormalities in developing embryo by using amniotic fluid. So we can find out whether there is any chromosomal abnormalities or not. Now, this aminosynthesis can be misused because you can find out the chromosomal abnormalities, you can find out the chromosomal matters. Hence, it can be always misused to find the fetal sex. So it is used for sex determination as well. And based on the chromosomal pattern in the amniotic fluid surrounding the developing embryo, you take it out and you determine, and you will have doctors either saying you directly whether it's a male or a female, or indirectly, they will start saying which whether it is a male or a female. Okay. That is again a wrong practice. Population explosion and birth control. That is another one thing, because we have a rapid population increase. So improved quality of life of people, increased health facility, better living condition had an explosive impact on the explosion of the population. So the tenacity of life has increased. Now, rapid decline in death rate, MMR, maternal mortality rate, or an IMR, infant mortality rate, along with increase in population of the reproductive age, is the main reason of population increase, explosion. So, all this always we have kept on seeing that there is a, we get the life tenacity as more. Steps to overcome population explosion. First, using various contraceptive methods. If you use contraceptive methods, then the birth is being controlled. Educating people about the demerits of large family. What would happen if you have a very large family? Increasing the marriageable age of male and female. Just when you increase the marriageable age, then the reproductive phase always decreases. Hence, you can have less number of children. Providing incentive to parents having one or two children. So we have got practices, the government has taken up various practices where they always reward the family with one or two children. So that is there. Next, we are coming to, now when I told you that some kind of contraception can be used, then coming to the contraceptive methods. What are the contraceptive methods? The contraceptive methods, they are used to prevent unwanted pregnancy and modifying the menstrual cycle. Now, what happens? What if you talk about an ideal contraceptive? What are the characteristics of ideal contraceptive? They needs to be user friendly. They need to be easily available. They needs to be effective, reversible. There should be no side effects on that, and no way interferes with the sexual desire and the sexual act. Now, contraceptive methods could be divided into the following categories. There are various types of contraceptives that are there. The first one being the natural or the traditional methods of contraceptive. The next one is a barrier method, where you just create a barrier. Okay, IUDs, intrauterine devices. You try to insert some kind of devices into the uterus of the female. Oral contraceptive methods. Some kind of pills or something has been used. Injectable. You inject some, hormones into the body so that the menstrual cycle is being disturbed. And then there are quite implants, and then after the surgical methods, you just create a surgery. So first method that we were talking about is a natural method of contraception. So when we talk about natural method of contraception, it is completely based on your calendar, your standard days, which is happening, your menstrual cycle is taken into consideration. So first and foremost, we have something called as periodic abstinence. So what is periodic abstinence? The couples avoid coitus from the 10th to 17th of menstrual cycle of as chances of fertilization are very high. So what happens is your ovulation period is being avoided. This is called a fertile period. At that point of time, 10th to 17th day of the menstrual cycle, the female is ovulating, hence she is very fertile. Hence they avoid any kind of coitus during those periods. So as a calendar, you can take it up. Lactation amenorrhea. So lactation, if when the when there is a childbirth, when the female is lactating, then lactating means there is an intense milk feeding which is taking place. There is no ovulation that takes place during this period, and so chances of fertilization is nil. So that is being taken care. And withdrawal or coitus interrupt. So there is a withdrawal or coitus interrupts wherein the male partner withdraws the penis from the vagina just before ejaculation. So just before ejaculation, it has been taken out. The penis has been taken out. So this is another way how it can be done naturally. So what happens in the natural methods is it is having no side effects as it is completely in natural way. But the disadvantage is there is a high rate of failure that can happen. Okay. Next, we have the barrier contraception. So we are creating some kind of barrier for the contraception. So in these cases, we have the male condoms, we have the female condoms, and the diaphragm. If we talk about male or female condom, then what happens? It creates a barrier made of thin rubber or latex sheet, and it would be used to cover the penis, or in the case of females, it would cover the vagina and the cervix in the female just before the coitus, so that the ejaculation of the semen would not enter into the female's reproductive tract. The other ways, we have diaphragms, cervical caps, and valves. All these things are there. They are a barriers which is made up of rubber and is inserted into the female reproductive tract to cover the cervix during coitus. They would prevent conception by blocking the entry of sperm through the cervix. So they are reusable, and there are some spermicidal creams, jellies, foams, which are there, which are usually used along with these barriers to increase their contraceptive efficiency. So the efficiency of the contraceptive would increase. So here there is less chance of failure. That is one positive thing. But again, when you are using an external method, there can be chances of infections or STDs can be possible. Next, I have intrauterine devices. Intrauterine devices would mean you are trying to insert some kind of devices into the uterus of the female. So they are inserted by doctor or trainers into the female uterus through vagina. Now, IUCDs may be non-medicated IUDs. Example, we have Lipple Copper releasing IUDs are there. That is copper T we have. Then copper 7, multi-load 375. These are the examples of copper releasing IUDs. And hormones releasing IUDs are there, where we have progesterone, LNG20, all these things. Now, IUCDs, they increase the phagocytosis of the sperm in the uterus, and copper reduce the motility and fertility capacity of the sperm. So either the sperm is phagocytes, and or if we have this copper T or something, the copper which is released will reduce the motility of the and fertility of the sperm. Now the hormones releasing IUDs, they make the uterus unsuitable for implantation and the cervix hostile to the sperm. It is ideal for female who wants to delay pregnancy and spacing between two children. So it is very ideal for them. So they are being induced by the doctors, hence they are very sterile. They are quite good enough. And another thing is, this will, this also has a very good amount of, less amount of failure. The positive amount is good, whereas the negative impact of it is, again, you need to go to a doctor to do this. So it's all again costly. And again, one more thing is, this is again an external device which is going to be induced by the doctor. And for this, there should be a proper planning. Here, this always includes a proper planning. So it is a duration of time. If you have to keep a long gap, that is when you have planned it and you are trying to induce some kind of IUDs. So this is not very temporary. Okay. Next, we have oral pills. Now, oral pills are progesterone or progesterone estrogen combination used by females in the form of tablets. They exhibit ovulation and implantation as well as change the quality of the cervical mucus to prevent or retard the entry of sperm. So these pills will only change the change the cervical mucus which is being released. Now, administration of progesterone or progesterone estrogen combination within 72 hours of coitus is found to be very effective as emergency contraceptive. So these are pills you take in after coitus, and your pregnancy is stopped. It is used for a contraceptive method. Next, we have surgical method. Now, surgical method is a permanent solution. Permanent solution in the sense, it is also known as sterilization, which is generally advised for male or female partnered as a terminal method to prevent any more pregnancy. Now, in case of males, it is known as vasectomy, because in the surgical method in the male, a small part of vas deferens is removed or tied up through a small incision on the scrotum to prevent release of sperms. So here in the males, as the vas deferens is being tied up, is being removed. So now what happens is, that is known as vasectomy. And in females, it is tubectomy. So tubectomy, the same thing is being done. A small part of fallopian tube is being removed surgically. So that is known as tubectomy. So these techniques are highly effective, but the reversibility is poor. You cannot reverse the technique. Now, what are the side effects of contraceptive method? It needs to be emphasized that the selection of suitable contraceptive method. So you need to be very, very judgmental or judicial based on what kind of contraceptive has to be used. Now, it is used because its use should always be undertaken in consultation. You need to consult a medical physician to understand what kind of contraceptive should you be using. And you need to be rest assured that it is not a regular practice. So you are trying to do something against the normal biological ways of contraception. So it's a practice against the natural reproductive event. So always a consultation is required. However, there are possible ill effects. It can be nausea, abdominal pain, breakthrough bleeding, irregular menstrual bleeding, all these things which can happen. It can even lead to breast cancer, though not very significant, should not be totally ignored as well. So there are a lot of cancers that can come up because of usage of contraceptive. Now, there's something called as medical termination of pregnancy. Abortion is illegal. When we say abortion, sex determination and an abortion of a female child, female infanticides, all these are illegal. Now, voluntary termination of pregnancy before the full term. This is called MTP, medical termination of pregnancy or induced abortion. Now, it plays a role in decreasing the population by aborting the unwanted pregnancies. Now, unwanted pregnancies can be aborted. Now, what are the ways that we can do it? Now, in India, MTP is legalized in 1971 with some restrictions to prevent its misuse, such as indiscriminate and illegal female feticide. So it is indiscriminate, it is illegal female feticides, all these are not used. MTP is used to get rid of unwanted pregnancies due to unprotected intercourse or failure of contraceptive use during the coitus or rape. So if you have conceived because of rape or any kind of, you know, unprotected intercourse, it can be removed. When pregnancy continuation could be harmful or even fetal or the mother, then we can go ahead with MTP. If the mother and the child, both they or either of them is having some kind of life risk, we can always, get it advised for MTP. That is medical termination of pregnancy. MTP are considered relatively safe during the first trimester or up to 12 weeks of pregnancy. Second trimester, MTPs are much more risky. So, whether if we decide on not keeping the baby, it is within the first trimester, and by the first trimester, you can go ahead with the MTP. Now, coming to another very important matter, which is sexually transmitted diseases, or we say is STDs. Diseases or infections which are transmitted through sexual intercourse. They are collectively called as sexually transmitted diseases or venereal diseases, VD, or reproductive tract infection, RTI. So this is how it is named. You can tell it as VD, you can tell it as an RTI, you can tell it as an STD, anything. Now, some common STDs are gonorrhea, syphilis, genital herpes. So there are so many kinds of AIDS, hepatitis B. So all these are various diseases that can be caused by STD. Now, hepatitis B and HIV, they are transmitted by sharing injection needles, surgical instruments with infected person, transfusion of blood and everything. From an infected mother to the fetus also it can be, it can be get transferred. So that is how hepatitis B and HIV can also get transferred. Now, except genital herpes, HIV and hepatitis B are completely curable if detected earlier and treated properly. Now, timely detection of proper treatment of STDs, they are very important. Otherwise, it could lead to complications later, which include pelvic inflammation diseases, PIDs, abortions, stillbirths, ectopic pregnancies, infertility, or even cancer of reproductive tract. Infections of STD can be prevented by avoid sex and with unknown partners or multiple partners. Second, always use condoms during coitus. Go to a qualified doctor in case of doubt for early detection and get complete treatment if diagnosed. So, this all the things can prevent sexually transmitted diseases. And now coming to another reproductive health and maybe a very common one, presently, which is infertility. So, infertility, the couples which are unable to reproduce children in spite of unprotected sexual cohabitation, they are called infertile. The reasons for this could be many physical, congenital diseases, drugs, immunological, or even psychological. Now, infertile couples can be assisted to have children through certain special techniques commonly called assisted reproductive technologies, ART. What is ART? Assisted reproductive technologies. So, for those couples who are infertile, so for them, we use ART, that is assisted reproductive technologies. So these includes IVF, in vitro fertilization. What is in vitro fertilization? In this case, fertilization outside the body followed by embryo transfer, which is commonly called test tube baby. So we have in vitro fertilization. Now the ovum from the wife and the sperm from the husband donor are collected and induced to the
fertilized in the laboratory conditions. So all the ovum and the sperm, they are fertilized in the laboratory condition. And the zygote or the early embryo, which is in the 8-cell blastomeres, they could be transferred into the fallopian tube, which I called as ZIFT, zygote intrafallopian transfer. Zygote, Z, intra, 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 fallopian transfer. And embryo with more than 8 blastomeres, where it needs to be put in? It needs to be put it in the uterine, right? So that is known as IUT, intrauterine transfer, into the uterus to complete the further development. So first in IVF, if I am trying to transfer the zygote, it needs to be zygote fertilization takes place in the fallopian tube. So I need to put it inside the fallopian tube. So it is zygote intra-fallopian transfer. And if it is more than 8 blastomere stage, where it is the blastomeres, they get implanted into the uterus. So after 8 blastomere, I need to put it in the uterus. So it is intrauterine transfer, IUT. Now there are again cases of IVF when I'm taking place when the fertilization is difficult inside the female. Now GIFT, gamete intrafallopian transfer. So in this case, the transfer of gametes collected from the donor into the fallopian tube of the female who do not produce ovum. So GIFT is being used for those who do not produce ovum. So IVF, what was happening? Fertilization was not occurring, but the female was able to produce an ovum. Hence, the female ovum was being collected from the female or from the donor, depending on either cases. Okay, so GIFT is when the female is unable to produce the ovum itself. Now, intracytoplasmic sperm injection. Now, specialized procedure to form an embryo in the laboratory in which the sperm is directly injected into the ovum. So that is being done. So artificial insemination, in this case, infertility cases in which male partner is unable to produce healthy sperms are treated by a technique in which semen is collected from the donor and is artificially introduced into the vagina or into the uterus of the female. So all these techniques are extremely high precision handling by specialized professionals and expensive instruments. Therefore, the benefits are limited to certain countries and people. Emotional, religious, and social factors also prevent the adoption of these methods. They would say whose child, how this. So there are various religious matters which prevent these kinds of support. So thank you.